Bismillahirrahmanirrahim. Assalamu alaikum. In today's vlog, I shall discuss a very sensitive medical topic, the topic on which people don't discuss in open. But when patients come to me and I inquire, then they do agree that they are suffering from this disease. I'm talking about a disease called erectile dysfunction. Are you unmarried and you feel that you have reduced sexual desire or libido and difficulty achieving or maintaining an erection? Or you are married and from day one you have reduced sexual desire or libido, difficulty achieving or maintaining an erection, premature ejaculation or delayed ejaculation. Or you were good at sexual performance and now you face reduced sexual desire or libido, difficulty achieving or maintaining an erection, premature ejaculation or delayed ejaculation. Then there are high chances that you must be suffering from erectile dysfunction. Erectile dysfunction means persistent inability to achieve or maintain an erection sufficient for satisfactory sexual performance. It's a common issue affecting millions of men worldwide and is often treatable. It's very important to seek medical advice and remove the stigma. I shall explain all this via case history of one of my patients. My today's vlog is purely on public awareness of the very important issue, that is the erectile dysfunction. The purpose of this vlog is to create awareness, to remove the misconceptions about this disease, and to help you out to get a proper medical advice on this condition if you or any one of your friends or relatives is suffering from this one. As said in the intro, I'll start with a case history of one of my patients. I won't disclose his name. He is 52 years old, office worker, and married for 20 years. Why did he visit me? It was the difficulty maintaining erections during sexual activity over the last 8 months. History of presenting complaint was that this dysfunction started gradual. It was gradual in onset over the past 8 months. It's a persistent problem during sexual activity occurring every time. He was initially able to achieve an erection but loses it within 5 to 10 minutes. And this happens every time he meets his spouse. And asking about the morning erection rarely present over the past 1 year. The associated symptoms, he has now reduced sexual desire over the same period, that is 8 months. There is no pain during erections and no ejaculation difficulties. And asking the psychosocial history, he has got increased work-related stress over the past 1 year. He has got relationship tension due to this issue. There is no history of mental health issues, but he reports mild anxiety recently. He is a non-diabetic for 10 years and using oral hypoglycemics. He is hypertensive for the last 8 years and using beta blockers. No history of cardiovascular events or major surgeries. Currently, he is using metformin 1000 milligram per day, atenolol 50 milligram per day, and no over-the-counter medications or supplements. About the lifestyle and habits, he has got sedentary lifestyle, no regular exercise. He is a smoker of 10 cigarettes per day for the past 20 years. Not using any alcohol, and he is mild overweight, BMI 29. He has got stable sexual history. He is married with stable relationship. Before this weakness, he was having regular sexual activity, and there is no history of sexually transmitted infections. In the family history, he father died of heart attack. He was having diabetes and hypertension. When I asked about the red flags, none of that was identified. It was not of sudden onset. There was no penile deformity or systemic symptoms like fatigue or night sweats. So the initial assessment which I made, the probable cause was diabetes-related vascular damage and probably side effects of beta blockers, and his lifestyle factors like smoking and lack of exercise, and of course the psychological stress, anxiety exacerbating the condition. So I did the detailed physical examination. I checked his blood tests, blood glucose, HbA1c, lipid profile, testosterone levels. I did discussed with him the lifestyle changing, and of course I educated about the interplay of medical, psychological, and lifestyle factors. And of course, if that didn't work, I was planning to start him on the some drugs for that. So from this case history, it is very important that when you go to your doctor, the doctor will take your medical history, the typical conditions, how the thing started, what are the risk factors, what are the type of erectile dysfunction you are suffering from, and all that. So this is very important that you go to your doctor, so the doctor takes your history, and then he examines you and he excludes any other contributing causes. So in this, from this case history, uh, we shall try to find the answers for questions like what is erectile dysfunction, what are its causes, how is it diagnosed, how can it be treated, what are the novel and emerging therapies for erectile dysfunction, what about you, do you really suffer from erectile dysfunction? Many people think it's just a psychological problem. Nothing like erectile dysfunction exists in medical field. Others people think it's purely a medical problem and nothing to do with psychological issues. In fact, thinking on extremes is 100% wrong. Both scenarios are possible and it varies from person to person. Be with me so we discuss all these aspects. As I discussed, erectile dysfunction is the inability to achieve or maintain an erection sufficient for satisfactory sexual performance. It's a common condition that can affect men of all ages, though it becomes more prevalent with age. What are its causes? Erectile dysfunction can result from a combination of physical, psychological, and lifestyle factors. Common causes include aging, psychological factors like anxiety, depression, lifestyle factors like smoking or in case excessive alcohol, medications like taking antidepressants, blood pressure medications, hormonal imbalances, low testosterone, diabetes, vascular diseases like atherosclerosis, neurological disorders like Parkinson's disease, multiple sclerosis, or injury or trauma to the pelvis. Let's discuss this in some detail. As the age grows, the erectile function is affected somewhat. Psychological causes include anxiety, depression, or stress, performance anxiety, relationship issues. The lifestyle factors include smoking, excessive alcohol consumption, obesity, and lack of physical activity. And I just explained the drugs and the hormonal imbalances and chronic diseases like diabetes, kidney disease, or cardiovascular diseases. Similarly, the vascular diseases and neurological diseases does have a role. Symptoms, the four main symptoms of erectile dysfunction are: number one, when there is reduced sexual desire. Number two, difficulty achieving or maintaining an erection. Third is premature ejaculation, and fourth is delayed ejaculation. So all these four comes under the terms of erectile dysfunction. How to diagnose? Of course, this is the history and medical examination and categorization. What does erectile dysfunction means for that patient? Treatment options. There are so many treatment options. A tailored approach is important, which will involve the lifestyle modifications, medical therapies, psychological therapies, or surgical intervention. There are different ways. Your doctors will counsel you and he will tell you, first of all, to find out what is the cause of erectile dysfunction, and this he will try to alleviate that. There are specific drugs available for it, there are specific devices available for it, and there are different sorts of surgeries can be now offered to these patients to overcome this erectile dysfunction. So, dear, if you are anyone of your uh, relatives or friends is suffering from this condition, then despite of having uh, over-the-counter use of drugs, it's better you go to your doctor. So your doctor takes the proper history, the proper qualified doctor. He will take the history, he will examine you, he will do some investigations, and he will then advise you accordingly. So the erectile dysfunction requires a holistic approach that addresses both physical and psychological factors. A strong doctor-patient relationship and shared decision making are crucial to achieving the best outcomes. At this, I end this vlog. In today's vlog, I wanted to explain about this very common condition and try to remove the misconceptions associated with this and the unnecessary use of drugs, the unnecessary use of different uh, ways. So the important point is that you go to your doctor, discuss with your doctor, and then he will tell you what's the proper reason for your this issue. And here, inshallah, we will meet in another vlogs on some other topic. But this was very, very important. Patients come to me. They initially they shy, but then they explain, then they discuss with me. So this was an attempt to create the public awareness about this very important issue. Take care. Thank you. Khuda Hafiz.